Hi, welcome to our first Facebook Live panel. And today we're going to be talking about different approaches to coronavirus and treating it through lifestyle, nutrition, homeopathic remedies, and also the traditional pharmaceuticals. So first we're going to have our wellness specialist, Joel Hall. And Joel, you take it away.
Thank you, Kim. Thanks for joining us. I want to basically present things in two parts. The first part is related to supplements that I typically recommend, and the second part is actually referring to lifestyle approaches to staying well. So the coronavirus, of course, is a novel virus, so when we talk about immunity, we want to support immunity, of course, for many reasons, but we don't actually have specific immunity to the virus. So even having a strong immune system does not make us bulletproof, but what it does do is it helps protect us from bacterial co-infections and other opportunistic pathogens that might come along for the ride if we were exposed to the virus anyway. So pre-COVID, we might have wanted to be a good host to any guests that we were about to entertain, but under the circumstances where we don't want to actually be a good host. So what I mean by that is if we have exposure to viruses, it doesn't matter what type of virus it is, if our internal environment is not conducive to them being successful, then we don't have that much to worry about. So because we don't have specific immunity, we want to worry about interfering with the activity of viruses generally through indirect means, and the supplements that I would recommend for that purpose would be nutrients and also herbal products. So typically what I'm recommending is vitamin C, vitamin D, and as a baseline, and herbally I'm recommending elderberry, andrographis, and there's a few other things I'll mention in a moment, but the basic thing we're trying to accomplish here is to interfere with viruses' ability to function. Normally, what they're attempting to do, of course, is replicate themselves, which is something we definitely do not want them to do. And there are specific chemistries from botanical sources that actually interfere with enzymes that the viruses use to successfully replicate. So if we can employ those elements, we are likely to be able to avoid significant replication of viruses, keeping our viral load low. And in some cases, the botanicals are acting against specific viruses only, but we simply don't have enough information to know whether any of these things are actively working against this particular coronavirus. But based on what we do know about other coronaviruses, we have reasonable expectation that we can achieve some benefit. One of the other elements that I frequently use myself, and I don't recommend it that often simply because it's not high on my priority list, but the amino acid L-lysine is actually important in the sense that it helps to prevent viral replication through other means other than the botanical items I mentioned. So L-lysine is, I would consider, a strong addition to a strategy to suppress viral activity. So that's just one of the things on my list here. And one of the last things I'll mention is digestive enzymes are something that I use regularly myself, and it's obviously initially for digestive support. However, when we take these items, some, depending on how potent the product is, some of these items are actually in excess. They don't harm us in any way. They're actually very helpful metabolically, and the reason for that is that any enzyme that we take as a supplement actually spares our enzyme potential our pancreas has the job of producing many different enzymes for many purposes, and if we don't have as much demand digestively, we have enzyme potential for our metabolism and our immune system. So that's something we want to keep in mind, that those excess proteases in particular from the enzyme products can translate into extra immune benefit, and that's just sort of a passive exposure that I have regularly, and I think that helps me to stay well even though I'm not taking it for that specific reason. So there's a few things I haven't mentioned. Echinacea is a good example of something that might come to mind when we think of immunity. I'm not suggesting that Echinacea is unhelpful. My issue with Echinacea and some of the other herbs that we might go to is that while they are good, I think the other things that I mentioned are actually better. So if we have better tools to use, I would rather recommend those. But if all we had was Echinacea, by all means, I would be recommending that as well. But I try to find the things that are useful in as many different ways as possible, so that we get as much benefit from each item that we're taking. And so, what I want to do in regard to the lifestyle, a lot of people ask me what I take, and I just ran down that list of some of the things that I take regularly. However, many fewer people ask me what I do to stay well, which I think is a different question because it speaks to lifestyle. Obviously, we want to be socially distancing, and we want to be washing our hands, etc. But that's the bare minimum. There's quite a few other things we can do to keep ourselves well in general. And really the point of this is to improve our circumstances on a foundational level so that we're less vulnerable to pathogens. It's not specific to any one particular virus or germ. It's just a matter of having a strong foundation allows us to, should we become infected, we might have a better chance of recovering fully and enduring a lot less suffering. So just briefly, the list that I jotted down here is not comprehensive, but it's just things that came to mind that I do regularly that I might not otherwise think to mention. One of the things that we want to consider is viruses prefer a normal to slightly normal body temperature to replicate successfully. So maintaining normal body temperature and avoiding your body temperature dropping even a little bit is actually quite useful for slowing down the progression of a virus that might be in the system. It doesn't eliminate them entirely necessarily, but this is modeled on the idea that when we have a fever, it's our body's Hail Mary pass, so to speak, in an effort to suppress viral activity as aggressively as possible. We don't want to typically induce a fever deliberately, but keeping our body temperature elevated is quite helpful in slowing the progression or the replication process, which is may give our immune system time to recognize the threat and eliminate it before it develops into a larger problem. From a dietary perspective, I do recommend minimizing refined sugar because refined sugars are highly disruptive metabolically. They suppress the immune system, and also they tend to trigger an insulin response, which is a pro-inflammatory response, which has a lot of significant metabolic implications over time. So it's not a great strategy to be consuming refined sugar anyway, but especially under these circumstances, we need to try to reduce our exposure to maintain immune vigilance, so to speak. So the importance of exercise is something that it's hard to overstate, but we're not always able to exercise as consistently as we might want to or might be best for us. One of the things that we can do if we're housebound or the weather's terrible or can't get to the gym, etc., is to, walking is wonderful. However, there's a very specific activity that has been shown to improve immune response, and that is using a rebounder. I don't know if everyone knows what a rebounder is, but essentially it's a mini trampoline, and as few as 3 minutes on a rebounder will actually greatly improve your white blood cell count, which is something that's well appreciated, but in a way it's mimicking the effects of exercise without having the high impact, which some of us can't tolerate anyway, but it doesn't take very long to do. If you can do a similar thing on a bed, you can do it safely, that would actually be helpful as well. But always bear in mind that there's a possibility of falling and injuring yourself, so don't do anything too extreme in that regard. So I'm just being mindful of my time here, but I just want to mention a couple other things. Luckily, we're coming into a time of year when there's more daylight at a convenient hour, I should say, and we have occasional opportunities to go outside and experience natural light. And I'm not so concerned about producing vitamin D because it's not really warm enough to expose enough surface area of your skin to accomplish much of that. But there is a direct relationship between the amount of natural light that enters our eyes and regulation of certain metabolic processes, including circadian rhythm. And there are mood effects as well. Obviously, a lot of us are under stress, more significant stress than usual, so anything that can improve our mood in the short term is certainly welcome. And the challenge is that we simply do not know how long this is going to go on. So if we're under house arrest for any more weeks than we've already been, there's going to be a lot of tension, so to speak, and we need to do everything we can to try to dispel that, because if we don't pace ourselves, we're going to be suffering significantly in an emotional sense, which can also unfortunately drain our immunity further. So there's a lot more that I could say, but mindful of my time, so I won't go on. But I think it's important to keep in mind that we need to maintain our vigilance. We need to be disinfecting and hand washing, etc. But once we know what we're supposed to do and we are in the habit of doing it, I think it's important to not obsess about what's in the news, what's happening in the wider world. It's nothing we can really do about it anyway. I think we need to maintain perspective and try to cultivate a sense of peace within ourselves, because there's not a lot of help coming from the outside. Unfortunately, everyone's involved, everyone's at risk. We will get through it, but we're not going to. It's not going to be fast. It's not going to be easy. There's going to be other challenges we're not even anticipating. So try to find a way to remind yourself that there are still good things to appreciate, and spring is almost here, so that always helps my mood a lot.
Just want to start by thanking everybody at Coastal Wellness for inviting me to be on this panel today. It's nice to see cheery faces, right? And I'm really honored to have this chance to share my knowledge and my experiences during this COVID pandemic. So I also want to thank whoever is joining us through this Facebook stream, and to remember to wish everybody a happy Earth Day, which it is today. And to ask each of you to be kind to yourself and good to the environment. So for those of you who know me that are on here, I talk a lot and I talk fast, so I left myself some notes here to stay on task, to stay within my time frame. So if you see me looking down, that's why. My discerning use of homeopathic medicine is part of an integrative medical approach that I'm using to treat patients with presumed COVID-19. And I'm referencing the word presumed because unless somebody has had a positive test, we don't know with 100% accuracy that we're actually treating coronavirus. Well, I'll just go back quickly to talk about my discerning use of homeopathic medicine as being part of an integrative medicine program that I'm using to treat with presumed cases of COVID-19. And if you didn't hear this because of the streaming, I'm calling it presumed cases because without a test that's confirming a positive diagnosis, we don't know with 100% assurance and certainty that we're treating coronavirus. So the shortage of tests, both Maine and nationwide, has made all of this a challenge for our healthcare providers. If you're not familiar with what homeopathy is, it's a time-honored form of medicine that originated in 1796 with the innovative work of a German physician and chemist who is called Samuel Hahnemann. And his pioneering work showed a very deep understanding of the mind-body connection, and he was also influenced by the concepts of alchemy. To summarize a lot about homeopathic medicine into one sentence, I'll say it's based on the principle of like cures like. So of interest to me is that homeopathy is really part of world history, and if we weren't in stay at home and quarantine and we could all get together and go into a time capsule and program it to go back to the 1800s, we would all have an opportunity to see how homeopathy was used effectively in typhus, cholera, and yellow fever epidemics. If we stayed in the time capsule and go a little bit further forward into the Spanish flu of 1918, we could again see how homeopathy was used effectively as a treatment option. So there are many studies that came out post that epidemic or pandemic, which it truly was, to compare patients who were treated with homeopathy versus patients who were treated with what was available at the time, which was aspirin and quinine, and to show the difference in the outcomes, which was very positive for homeopathy. We've all been told that history repeats itself, and here we are today, April 22nd, 2020, in the midst of yet another pandemic. And for the past 5 weeks, I've treated many patients in my practice and outside of my practice with presumed COVID-19. So some people have presented with really early signs and symptoms because they were aware of their illness and wanted to get help quickly, and other people were at home sick for several days, and by the time they contacted me were really quite ill with complex respiratory difficulties. What I want people to understand is that all the patients that I'm treating with homeopathy through an integrative medical approach have a primary care provider, and that doctor or nurse practitioner, PA, whoever it is very aware of the patient's symptoms. And the reason that I'm saying this is patients with COVID-19 can look pretty stable and pretty healthy and be very sick very, very quickly. And it's important to me that I have a very fast and easy access to higher medical intervention if it's needed. Luckily, most people who have contacted me are in the very early phases with, I would call mild symptoms. And their doctors are telling them, justifiably, what any of us would be told, conservative measures: go home, rest, hydrate. However, what's different during this COVID-19 pandemic is that patients are being told one more punchline in here: stay home, quarantine, and very carefully monitor respiratory symptoms. So there are a lot of patients or people who are at home with mild symptoms that are almost like sitting ducks without anything to do other than to rest and to hydrate. And I think this is where homeopathic medicine has a big value point, and I've seen it in the patients that I'm treating. The reason is because when people call me, I'm looking at symptom patterns that cover both the mental, emotional, and the physical pattern of the person. So when somebody calls me, I'm basing my prescription on that whole person presentation and not a quote-unquote diagnosis of COVID-19. Through history, because I keep referencing history, in many epidemics and pandemics, within the international homeopathic community, we have something which is called a genus epidemicus. And by definition, the term is used to identify the particular characteristic manifestations of a disease, which tends to be related to local circumstances, such as season, the weather, the type of persons being affected. But most importantly, it's the value of this concept in homeopathy, which is related to the fact that most cases, in a specific epidemic or pandemic, in a particular locality, will be cured by one or a few remedies. Among the many mysteries that COVID-19 is presenting to all of us is that after reviewing thousands of cases internationally across 3 continents, we truly, as of today, do not have a genus epidemicus that we can give for COVID-19. It's a novel virus, and many different remedies are being used, and they're different in different locales within the United States and internationally. As one of our homeopathic masters that I'd like to quote, Andre Sen, says, "The key to success in homeopathy is strict individualization." I agree with him in many ways that when people are treated with a constitutional homeopathic prescription, their susceptibility to illness is a lot lower. But I live in real-time world and real-time medicine, and many people don't work with a homeopath and don't have a constitutional prescription. So let's talk about some of these key acute remedies that I've been using over the past 5 weeks. Some of them may sound really familiar to you because they're remedies that are used to treat flu. That's just typical what we would have called pre-COVID flu remedies. But in the midst of this pandemic, I'm cautioning people about self-prescribing if you don't have experience with homeopathy. People who are immunocompromised and have asthma, they may be more at risk with exposure to even a small viral load, and those people may develop more significant respiratory symptoms quicker. And when we're monitoring our cells and taking remedies, sometimes it's difficult to process where the remedy or where we're going next. So I encourage you to consult with a professional homeopath who can decipher and prescribe for you. Homeopaths can be found within the state on the main homeopathic initiative. That's a group of people committed to treating COVID-19. And across the state, you can access providers through the main association of homeopaths. So enough about generalities. Let's talk about specific early symptoms and some of the remedies that I've been using successfully. The media, and I think most of what people are hearing, is about fever, shortness of breath, big respiratory symptoms, overwhelming fatigue. People present sick. But what a lot of people aren't aware of are the early signs and symptoms that precede these more involved respiratory symptoms. So let me go through some of these with you, and these are from my shared experience and from my colleagues around the world, that there oftentimes is an acute presentation of sinus pressure and sudden onset of a frontal headache, pain between the eyes, loss of sense of smell, which I think the medical community is now identifying as one of the symptoms of COVID-19. A lot of my patients very early on have this intermittent, really sparse, dry cough, and they're describing that their lungs feel constricted. A few people have said they felt like there was a rubber band around their chest wall. A lot of people are restless with anxiety, and I think it's very important for us to acknowledge as this pandemic is progressing that we're understanding in a very deep way that COVID-19 is a multi-system disease. It is just not affecting the respiratory tract. So looking back retrospectively in earlier cases, but the statistics are showing us that 20% or more of patients had early GI symptoms. And now we know that people who have GI symptoms of nausea, mild abdominal pain, vomiting, and diarrhea are testing positive for COVID-19 without having any respiratory symptoms. So some of these remedies are really addressing GI symptoms. As time progresses, and in my practice, time means to me 12 hours, 24 hours, up to 72 hours. Some people are progressing to have muscle pain with fever, sleepiness, and extreme fatigue. Over the past 5 weeks, it's been interesting for me to observe the change in remedies that I'm prescribing more, and my colleagues are internationally. And on a run last week, I had this moment where I paused and I reflected, and I realized that some of the remedies are following or are parallel to the stages of grief that Elizabeth Kubler-Ross had spoken about in her books in Death and Dying. And those include shock, denial, anger, bargaining, and acceptance. All individuals, including me and our global community at large, were all in a state of grief for what was and the uncertainty of what's going to emerge at the other end of this pandemic. So the first remedy I'll talk about is Aconite. It's a remedy that's well known for shock and trauma. And in the early stages of this pandemic, Aconite was being recommended as a possible prophylaxis or preventative remedy. I've had 2 patients that early on were classic Aconite states. And in Aconite, the person has a sudden onset of a very strong sense of anxiety. And the anxiety goes one step further, that the person has an impending sense of death. They know they are for sure going to die. And what happens in this remedy is it comes on very suddenly, typically in the evening or whatever bedtime would be for that person. One lady woke up in the middle of the night with a small sore throat just to go to the bathroom and felt this impending doom that she was going to die, and felt driven to start to write letters to her family, her goodbye letters, and she knew something was really wrong and called me very early in the morning, and she was treated with Aconite. The other thing about Aconite that's interesting to me as an early treatment remedy is that patients oftentimes will have sensitivity to light, noise, odors, smell, and pain. So I wonder if this remedy is being used early, that it might be treating some of the more profound symptoms that we're seeing of a total loss of smell and taste. The next remedy is Arsenicum album, and I put that one next of interest because the Indian government is actually recommending that for prevention right now. And in Arsenicum album, the person has that intense anxiety, but it's very different because their fear of death doesn't have an impending doom. They don't have a certain sense that for sure they are absolutely going to die. The person is very restless, their body feels stiff to them, and they're often better warmth and warm drinks. It's a big remedy that we know of in our homeopathic materia medica, or our literature, that we use to treat GI symptoms of diarrhea. So when people, that is their first presenting symptom, and they're anxious, and they're worried about dying, Arsenicum is a good remedy to think about. The other thing about Arsenicum is people who could benefit by taking it have an overwhelming fear of poverty and extreme financial worries, which is prevalent, at least in this area where I'm treating people. So the next one is gelsemium, and this was the main remedy that was used during the Spanish flu of 1918. And the patients present drowsy, dizzy, dopey, irritable, want to be quiet and sleep. And it usually has a longer prodromal sense, so that people are usually sick for a few days before they feel a gelsemium state. And they're usually sleepy, they can't think, they just want to lay down, droopy eyelids, a lot of frontal sinus pain. And I wonder, just like Aconite was perhaps the first remedy of shock in the grief process, whether gelsemium is one where people are in a state of denial where they just want to lay quiet. The third remedy is Brine album, and this is the closest remedy that we have across all continents as a genus Epidemicus. There's more cases with flu-like symptoms that have responded clearly to Bryonia than any other remedy in the past 2 months over all 3 continents. So I've been treating people in the households of cases of COVID-19 with Bryonia, and I can say that that out of all the cases I've had, 2 spouses developed very, very mild symptoms of COVID-19, and in most households nobody else was sick, even though the primary person who contacted me was very symptomatic. In Bryonia, the person wants to lie down, be perfectly quiet, both physically and mentally. Anything that disturbs them on any level, they become incredibly irritable. Their worse movement, and one of the key things that people explain to me in a Bryonia state is that they have this desire to breathe deep, and even though they feel like they can get air into the deepest pockets of their lungs, it's almost like they're hungry and desiring to get more air in there. And that is a keynote of what I've seen, and also a loss of smell and taste is the main remedy that I'm using. Some people are recommending Bryonia 30C every few days as a prophylaxis. I can't speak to whether it's effective on a global basis, but I am using it, as I said, in the households of people that do have COVID-19. The last 2 quickly is Phosphorus, which is very well known as a cough remedy. For people who have homeopathic kits, these remedies are in there. People desire sympathy, company, very thirsty for very cold drinks. But the tricky thing about prescribing during this pandemic is that these things that we think about are keynotes or really important parts of a remedy. They don't have to be there, and people could be thirstless and still need the remedy Phosphorus. What I've seen through telemedicine is people are taking really short respirations, so they're breathing shallow, even though they're telling me that they can completely fill their lungs with air. And the last one is phosphoric acid, which is a very well-known remedy to us in the homeopathic field in our materia medica as a grief remedy. And I've had many patients that have needed this in the past 10 days. and the presentation is typically being apathetic or incredibly oversensitive and weeping at trifles, hearing an opera reduced to tears, sensitive to everything in their surroundings, the news, other people's problems, the worries of the world. They feel really weak, can't focus, and it's almost a collapsed state of weakness where somebody wants to lie down. They feel heaviness and, again, like phosphorus, some difficulty in the respiration. So I think my 10 plus, meaning I went over minutes, has passed. So I thank you for the privilege of sharing this information, and I'll be happy to take any questions.
Hey everybody, my name's Drew. I figured I'd just check in and talk about the hot drugs that I'm sure you've been hearing about in the media recently. The two that I hear the most of at the pharmacy are the hydroxychloroquine and the remdesivir. Mainly, the first thing I want to get out of the way is if you're thinking of a pharmaceutical option that you want to get from your local pharmacy, if you are afraid of coronavirus, really no option that's good right now. The FDA has not approved outpatient use of any of these medications you're hearing about. It's best left alone for inpatient use and hospital use because they are still under review, and there's a lot of potential side effects that need to be analyzed, or if it's effective at all. But mainly, hydroxychloroquine, it's been on the market for many years, close to 70 years. It's a tablet you take by mouth. Patients are regularly on it, and pharmacies normally regularly stock it. It's used to treat rheumatoid arthritis and lupus, and treat malaria and prevent malaria. And there are some studies that have shown that it's effective for treating coronavirus, but then on the other hand, there are studies showing that it's harming patients more than it's doing good. And then some studies it's inconclusive. It's not FDA approved to treat coronavirus, but they created an emergency use authorization, is what they call it. So they allow prescribers to prescribe it off-label, basically for patients who can't get clinical trial help at a local hospital. The reason that it's not really good for outpatient use is side effects I was talking about. It does have the potential to cause some arrhythmias, or QT prolongation is what it's called. A lot of other medications that are commonly prescribed also cause these, or can have these potential to cause arrhythmias. And when you use hydroxychloroquine with them, it's compounded and patients can have some really drastic or even fatal arrhythmias. You've probably heard of azithromycin as well. It's an antibiotic that has been used in conjunction with hydroxychloroquine, and they both have this QT prolongation. So these patients are especially at risk. And that's why if they're monitored at the hospital, they have leads attached to their chest, monitoring their heart, and that's really important. The other medication that you're hearing about, I'm sure, is remdesivir. This one hasn't been approved by the FDA for anything yet. It's an investigational drug. It's intravenously administered, so it's hospital setting only. And we're actually lucky enough to have a hospital here in Portland that's part of the clinical trial that's looking into its effectiveness and safety for coronavirus. Mayo Medical Center is one of 179 current locations who are enrolled in this clinical trial. So it's an option for patients that are able to get to a hospital that has clinical trials. And it's expected to wrap up at sometime in May, and it's been going on since early March. So at that time, we'll know more about it, if it is safe or effective for treating coronavirus. Until then, just kind of have to hold off and wait for more news, which is happening daily. I'm sure even while I'm talking, there's a new news article being released. One important thing I want to drive home is that we're still seeing some prescriptions being written for outpatient use for hydroxychloroquine and azithromycin. And I just wanted to make everyone aware, in case they aren't already, that patients who are using these for lupus or rheumatoid arthritis, there are some serious implications if these patients can't get their medication all of a sudden due to a shortage, which is likely to happen if everyone starts having their doctor prescribe them hydroxychloroquine to keep at home just in case. The Board of Pharmacy is advising pharmacists to be exercise precaution to avoid patient stockpiling, or even pharmacies from stockpiling. So we're all part of this together with being responsible and not spreading hype about the drugs until there's more information. The other thing that's a hot topic right now, pharmaceutical-wise, is vaccines. Right now, there is a lot of new information coming out. They're talking about timelines. Maybe 12 months from now, maybe 18 months from now, we'll have a viable vaccine. It's a new type of virus, or a new type of vaccine. There hasn't been a widespread coronavirus vaccine available in the past, so it's kind of like they're working from the ground up. For those of you thinking back to like H1N1 in 2009, that is a similar strain to the flu virus. And the flu vaccine that was currently available at the time was pretty easily modified, and they were able to actually roll that vaccine out by the end of the year, and when our first cases were seen in April in the United States. So this one's a little bit different. We may get lucky and get a vaccine out pretty soon, but there's tons of new developments. All the heavy-hitting companies out there who do these vaccines are investing billions of dollars, whether it be Sanofi or GlaxoSmithKline, Johnson & Johnson. The whole world is coming together to try and create a vaccine that will be effective. And as far as the time frame goes, there's a lot that goes into making these vaccines. The number one thing before you can convince the population to be vaccinated is you want to make sure it's safe and effective on top of that, but mainly safe. So it's in really small studies right now. Two companies in particular, Moderna and Inovio, they are in phase 1 human clinical trials. Moderna has 45 patients enrolled, and Inovio has 40 patients, so very small. At this point, they're just testing effectiveness, whether it's creating an immune response and safety. If it goes well, they'll move on to phase 2, where they get hundreds of patients in. And at that point, they're dialing in what dose is effective, a dosing schedule, and the method of delivery. Because these vaccines, they're not all going to be intramuscular injection. They could be oral use, or a new patch is a thought, or a nasal spray. So that will be developed as more patients are tested for it. And then after phase 2, continuation, phase 3 is just where thousands of patients who are healthy get immunized to see that they do have a sustained response. And that's part of the big thing about the timeline, is that sure, we can come up with a vaccine and we think it's effective, but if it only lasts for a month and you need to get revaccinated every month, that's not going to be a viable vaccine. So we're seeing, for instance, the Moderna vaccine that they are testing right now, their schedule is an injection intramuscularly on day 1, then a month later, and then follow up for an entire year in this study to see how it affects and how your body's immunogenic reaction, if it's effective. So there will be a time frame where we're still just getting a lot of confusing reports from the media, a lot of new companies in clinical trials, but we just kind of have to sit back and try not to get too worried. It will be along soon, and I think it'll be important for the population to get vaccinated. That will help avoid a even further spread of the current virus that's out there.
So in the webinars and Zoom calls that I've been on over the past month, nobody's really discussed the use of Fuya, so I couldn't comment on it. I haven't prescribed it in my practice. I don't have any experience with it. Depending on the level of illness in the family, I'm recommending that people do a 30C potency, probably 2 times a day. There's another way that you can make a homeopathic pellet into a potency which is called plus. And when you do that, you just take a small glass of water, like 3 or 4 ounces, just like a juice glass, I guess that would be, and dissolve a few pellets into it. And then you take that glass and you swirl it like 15 or 20 times, and you can sip out of it several times per day. So for the families that have people that are very sick in their homes, I'm recommending either twice a day or plussing the bryonia. There are some homeopaths that are recommending 200 Cs, and a lot of us are using high potencies. But I feel like for people who don't have experience with homeopathy, I'm not recommending that they try to get a hold of the higher potencies and that they work with a professional homeopath.
So I just wanted to say that in spite of the challenges and the logistical obstacles, we are still very much open for business. We still have a lot of products that can be helpful. Please do fill out the form on our website or give us a call if you need anything. We're doing shipping and curbside pickup. So we do have product and resources available. There have been product shortages and there will continue to be, but we are working hard to try to have a representative sample of all of the things that we typically would be recommending and anything that practitioners locally would be suggesting that we carry. We also try to have those on hand if possible. It is a difficult process because everything is running much slower, and even if we can get product, it takes a while to get to us, but we are still very much available to answer questions and take orders, and we're going to try to support the community as best we can, even under these sometimes challenging circumstances. And the sooner we collect ourselves with regard to proper protocols, the sooner we can get on with normal life, and I think together that we can accomplish this. So those are my thoughts.